What's going on, everybody? Welcome back to the Future of Healthcare podcast. As always, I'm your host, Nathan Dollinger, and this is another Whatever Wednesday episode. And as always, I'm joined by our co-hosts, Bernie Liu and Tim Mayo, and we just had a absolutely incredible conversation talking about how Amazon is about to take over the healthcare space along with JP Morgan and Berkshire Hathaway, leading into Apple's new EHR that they're hoping to start, and then that even fed into Anthem and how supposedly, according to Vox, they're about to kill people because they're not going to reimburse people for their ER visits or something. That's at least what I got of it, but I don't know. What do you guys think, boys?
Yeah, listeners, if you've been subscribing to our health report, you may have already heard about this stuff. So you can join in on this conversation. If not, go to our website, wearethefuturehealthcare.com. Click that subscription button, plug your email in, and then you're going to get some weekly news from us.
Yeah, and of course, don't forget to follow us on Twitter and as well as Instagram. And recently, we made a LinkedIn. So for those young professionals out there, give us a follow on there so that you can have access to all of our guests' information on LinkedIn.
And with that said, let's just hop right into the episode. Without any further ado, here is Whatever Wednesday, episode 9. So we have Ken Bone, we have our professional Wags dog walker, Tim, and then we got Bernie Liu coming at us from Kansas City. Officially, he's no longer in Canada. Bernie, welcome back to the States. We're glad you're back. Look at that. Ken Bone. Gosh.
This is Nathan.
Yeah,
Ken Bone.
For all the beautiful listeners out there, for all the listeners out there, these
Pride of St. Louis.
Ken Bone, the Pride of St. Louis. If you guys remember the presidential election debate between Donald Trump and Hillary Clinton that was at Wash U, we had Ken Bone, who's dressed in just a lush red sweater, and I am currently rocking a just as lush red sweater, and I look ridiculous. So if you're watching this on YouTube, welcome. All the listeners on the podcast, welcome. Tim, Bernie, what's going on, guys?
Hanging in there, man. Are you seeking out a IZOD promotion the same as Ken Bone?
What happened to the guy? He disappeared.
I don't know. I think he got some sort of inquiry from IZOD and then it fell through. Ken Bone just being that sly dog that he is.
Gosh.
Yeah, didn't he come up to SLU for a little bit or something? I remember people getting pictures of him.
Yeah, he was at SLU. Yeah, for I think it was the College Republicans. He came for one of their meetings.
Yeah.
It's a great time. But I don't know, guys. It's been a crazy week in healthcare. I gotta say at the least. I mean, my favorite thing, and I was talking about this with some people the other day, how the Amazon, JP Morgan, and Berkshire Hathaway announcement made more of a rattle in the healthcare space than the entire State of the Union address because Donald Trump barely touched on anything. So I'm happy about that. The private sector is making big moves, and we don't need to worry about the government. So, guys, what do you guys think about this Amazon thing? Because I know Bernie freaked out, messaged me at about 5:30 in the morning, and was like,
"Yeah,
Nathan, look at this." I was like, "Bernie, I'm not even awake yet."
Yeah. So I texted you guys. Well, yeah, I think it was 5:30 in the morning. I mean, I'm up at 5 every day anyways. So, I saw on the news, literally this guy on Channel 5 News broke it and said, breaking news, Amazon, Berkshire Hathaway, JP Morgan planning to create their own healthcare company. And that was it. No other information. So I texted you guys. I was like, hey, so that'd be huge news. Let's get in the newsletter. Let's talk about it on the podcast.
Well, Bernie, obviously, I know you started freaking out about it. So did you dig at all into it? Because they barely gave any details. They didn't talk about what is it?
So I took the first 30 minutes at work, and I was like, I have to know what this is about. This is healthcare. This is everything. This is got me written all over it, right? So basically, what the news is Amazon, Berkshire Hathaway, and JP Morgan have decided to pull all the resources together to provide their employees with a new type of healthcare plan and healthcare initiative. So they're starting from what I believe is the technology side of it. I think setting up some kind of app maybe or some kind of platform to where their associates can access their healthcare information or providers through that. And they're going to slowly move from there. But that's all I have so far.
Well, Bernie, do you know, because I've heard rumors, but I haven't looked into it enough myself to validate them. Is it true that they're looking to expand these services to other businesses? Because I've heard people talk about how Trump is shying away from acquiring the provision of healthcare insurance to employees in companies under 50 people or so, and how that may or may not be affected by Amazon services. So is that some sort of implication that Amazon, JP Morgan, Berkshire Hathaway are going to be providing this to people throughout the country?
I don't think so. And I think people have been taking this news and really going way too far beyond with it.
Yeah.
They are really starting at their own employees. They really have no foundation to work with yet, right? These people are stepping into the healthcare realm as, you know, new.
I mean, like like you're trying to say like new players. The my brother texted me shortly after Burning texted me. My brother sent me a text and he's like, Nathan, what are your thoughts on this? Classic. The two people I would expect to text me. But my brother shot me a text. He goes, what are your thoughts on it? My very initial response was, it's one step closer to Amazon knowing how the way I poop dictates my purchasing habits. Because it's like,
Oh my goodness.
they're literally like, honestly, because it's a scary thing knowing a company with as much intellectual property and so much data as Amazon all of a sudden getting into the healthcare space. I mean, I'm excited about it. I think they are really going to be disruptive in many ways, really push forward telehealth and the apps that they could potentially develop because they have so much money and they have a huge focus right now that I feel like they're going to do incredible things. But it is, opening up these gateways to, this question about the amount of data that companies have on us, and are we okay with that?
Well, excuse me if I sound naive here if I'm going off topic, but I'm thinking of how Amazon has Black Friday. They have deals where you can bundle items, and at the bottom of your page it'll say like, you've been searching for Nike shoes. Here's something else you may like, and there's Adidas shoes. So maybe someone with diabetes will be shopping, if you will, and then it'll be suggested that they have an insulin product or a different type of insulin pump at the bottom of the page, and they can package these together and receive some sort of deal. Or perhaps given Black Friday, they could have 40-50% off their healthcare, stuff like that. Is that even conceivable in your guys' opinions?
So, Bernie, you got a comment? You see me answer the vid here.
Yeah, no, I do. And like Tim, I'll be honest, like these are all grandiose ideas, right? Like we're thinking, oh, Amazon's going to get into healthcare. All of a sudden, everybody's going to get 2-day physician shipping, right? Or something like that, right? They're going to get their doctor shipped to them in 2 days, and they're going to get seen whenever they want. I mean, which would be great, right? I tried calling in to get a primary appointment last month, and the earliest that I could get it was in April. So I would love to see a doctor in 2 days if I could, and if Amazon could provide it to us. But I think we're thinking about this in like such a futuristic idea where we don't think about like where our laws and legislations are now, that even a massive company like Amazon can't avoid that. They can't avoid the FDA. They can't avoid restrictions on things that keep healthcare from being innovative as it could be.
Well, I want to point out, like, the main reason why they're doing this is because these large companies, Amazon, Berkshire Hathaway, JP Morgan, they realize the crippling aspect that healthcare has on corporations and is having on the U.S., and they are the first big company who's not in the healthcare space to take an initiative to be like,
Right.
We're going to change this. We're going to do something about it, which is incredible. And I love seeing that because I work with, corporations in St. Louis every single day, and all they talk about is how this is honestly killing their bottom line. Corporations now that are very, very large have multiple employees that are costing them upwards of $1 million a year on their healthcare expenses. So it's something crazy to think about, like, a single employee may not even produce $1 million worth of value through all the work they do, but they are costing you, maybe double, triple of all the work that they're giving you. And it's something like, it's difficult for these corporations to do, like, how are we supposed to survive? And I love to see Amazon's like taking the next step and be like, you know what? Let's do something about this. If all these like health companies are going to bicker and take a lot of time, they're like, you know what? Screw it. We're going to do it. We're going to make the change. But I'm just passionate about seeing that. But I do want a real quick note on the kind of the data side. I was watching a video, Linus Tech Tips. He went into the Amazon Go store. And I don't know if you guys like kind of saw the Amazon Go store that just kind of opened up in Seattle, but it has all these cameras that watch. So you walk in, you scan your like Amazon Go little app thing on your phone, and these cameras watch you, where you walk, what you pick up. There's little sensors, and they kind of know exactly where you're getting. You stick it into your bag, and then you just walk out without having to pay for anything. Well, Linus, after he did it, he walked through. He's like, it's kind of scary when you actually look at the technology and what they're doing, because all these cameras are watching all your moves, and they're watching what you pick up and set in your bag, what you pick up and set back down. But when you think about it, the potential data points that they could be tracking on you when you're in there, like Tim, the reason why I'm bringing this up is because you referenced it about your shopping, and you're looking at some sort of medication, or you're looking at some sort of product. They see you pick it up, think about it, and then set it back down. Just like how now you go on somebody's website page on the internet, and the next time you go to Amazon, that thing is advertising towards you.
Yeah.
This could happen where they're tracking your physical movements inside of their store. And then all of a sudden they can dictate that and translate that data back onto their internet platform. And it's something that, okay, if all of a sudden they have your health data too, they're like, oh, this person's getting in some things, I don't want to be always terrorizing, because say they know that you're unhealthy and living an unhealthy lifestyle. What if they start advertising healthy options towards you? What if they start advertising fitness programs, or they start advertising organic products or things like that? They could do great things, but it is ultimately benefiting them. So it is scary at the same time. What are you guys' thoughts on that?
I had a question for Bernie, because I'm not as into the logistics, with you being at Cerner, Bernie, or Nathan, you being in your program. So I'm sort of thinking you have all these guys who have been pretty big innovators in the last decade, 2 decades, and they have these fat stacks of cash in their wallets. But given all the regulations that the healthcare field has on it, FDA and I don't know, any number of regulations.
Just the government in general.
The whole government.
Right, yeah. How is the amount of money that they have going to have a drastic effect on healthcare?
So if you read any of the articles that got posted about this collaboration, they noted two key things, which was one, that Bezos wanted to start with technology, and two was that this was going to be either free, low cost, or a non-profit driven ideal. So that's important here. All right. Healthcare does cost a lot of money, but at the end of the day, these insurance companies who are billing us are taking a lot of the profit in order to pay for their individuals who are working in their C-suite, whatever the case. At the end of the year, any premium that's left over kind of goes into a bonus check, because they're already duly going to be paid the next year, because people are already signed up for healthcare, and the premium is going to not roll over, but rather they're going to get more money in the pool again. So having this be a free, nonprofit driven system gives these three the more resources and money to put back into their employees.
Yeah, I mean, so the thing I think about is these large corporations are looking at, healthcare is not, it's not, as a lot of people, there's an argument, is it a right or a privilege? Well, it's really neither. It's a social good. When people are healthy, all boats kind of rise. So these corporations are looking how can we help our employees live a fruitful life? Because ultimately that will help benefit the corporation. So when you look at Bezos, look at the DNA of Jeff Bezos and what he has done from when he started Amazon back in the 90s and what he's done. He is a workaholic, is all about efficiency, is all about squeezing efficiencies out wherever he can. And he's like, you know what? We're losing money, all the healthcare. We're going to do everything we can. We're going to do it not for profit, work with these people, and help our employees achieve a level of health that we can do through our telemedicine, our data, everything that we can do. Because a lot of people are asking, is Amazon going to run hospitals? No, I don't think so, because that won't benefit their national brand. What it's going to be is it's going to be a telemedicine, preventative wellness type initiative that all these employers are going to benefit from. And because they're going to start it, ultimately it'll be very rewarding for them, because it'll start spreading through other companies as well. And to talk about the government, Tim, it's all just red tape. The government regulation is a big hindrance for a lot of the advancement we need to see right now.
No, I totally agree. And that's, I'm going to use Peyton Manning as an example, right? So he had his
Peyton Manning
procedure, right? So he had his procedure done in. You guys are awful. So he went overseas to get his procedure done on his neck, and came back to have an MVP season, right? Well, he went overseas because they weren't going to do it here. So, I mean, that kind of just says it all, right? Like, they're doing innovative things in Europe that aren't necessarily being done here because we have so many regulations that keep drug companies from, putting things to market. Maybe in a year, they have to go through it in like a few years.
I would hope to get out of this Amazon deal that they have. Someone please correct me if I'm wrong, but a recent number that I saw was roughly 600,000 employees, maybe a little under that nationwide or worldwide even. I think if they're able to provide a sustainable model for healthcare just for those companies, and I'm only talking about Amazon right now because I don't have the numbers on the other two companies involved in this merger. But
Amazon is kind of the face piece of this initiative. JP Morgan and Berkshire are there for the extra cash and muscle.
So I think it came out to be like about 1.1 million employees or something like that.
Yeah. So if they can provide a sustainable model of healthcare for just those, I don't think they necessarily have to change healthcare themselves in a direct manner. But if they could provide an example, then I think that would become useful for healthcare in general because they cover all different types of demographics, all different types of socioeconomic backgrounds. So I think that whatever model they implement, if they're able to be successful with that, I think that's something that we could mimic on a larger scale across the country.
Mm-hmm. Right. And I think at the end of the day, they're doing this as a preventative measure. Just like the flu shot, if you take the flu shot, you're less likely to get the flu. So if you're an employee that has been vaccinated for the flu, you're more likely to be productive because you're going to be at work longer, right? So at the end of the day, all three of these companies are paying themselves because it's just money that goes right back in their pocket from their employees being able to work more and produce more revenue for them.
Yeah, and I love to see that. And there's another, like, Amazon isn't the only company. I mean, you got Apple just came out with how they want to break into the EHR space, which has been evident for years. They've wanted, their Apple Watch to be a medical device glucose monitor, but there's too much. It really can be. It's at that level, but it's just they don't want to have to go through the medical device regulation that all that has to go through. But that was exciting. Other news this week about how Apple, they're trying to make it into the EHR space to make it more accessible, which references a topic we referenced last week, and it was funny that the news came out literally after we released the episode, after we recorded the last episode, because we were talking about interoperability, and then all of a sudden, literally the next day, Apple's like, oh, interoperability? Don't worry, we got this. Health records on your iPhone.
Well, I think it's cool that you mentioned the Apple Watch because there's a Zebra Technology conducted a survey, and I don't know how widespread the survey was, but from those that filled it out, 95% of the people said that they were willing to share the information gathered by their wearable devices, such as an Apple Watch or a Fitbit. So if we can have that amount of information just sent directly to our phones where our EHR could one day be stored, that'd be pretty incredible and pretty easy way to collect data on a large amount of people.
Yeah, and because, Tim, that's all about the user experience stuff. The reason why Apple devices are so successful and really smartphones in general is you can pretty much hand anybody a smartphone today and they can figure it out. A new app comes up and you can slowly figure it out. But the fact that in order to get access to your health record, you have to download some random app or go on some internet platform that you're not used to, if we can get it to people as in a usable form as possible, that is what we need. So that's exactly what you're talking about. People, as long as people are willing to take advantage of that and they have an easy access to it, it's going to be a great thing. So I'm interested in it. Bernie, what are your thoughts?
Yeah, look, I'm 100% for interoperability. I can say that word this time. And
interoperability, that was how you pronounce it last time.
Interoperability, right?
Making up words here, Bern.
So one of the best things is that Apple is working with Cerner, as well as the other two large electronic health record platforms, Epic and Athena. But, they're doing good things here, right? Like, it's important for people to have access to their electronic health records. I've heard nightmare horror stories of people trying to get their records from their doctors before electronic health records existed, so that if they moved from one physician to the other, they'd have records of their loved ones' data wherever they went. So now this becomes easier, right? It's on your phone. People have their phones every single day. They have their health data wherever they go. If they get into an accident, a fender bender, or if they happen to have a heart attack on the side of the road and they get rushed to the emergency room, their data is on their phone. So it's easy access for everyone.
So on that note, we have people entering their own data, like say your own allergy, your height, your weight, basic information, maybe logging your immunizations. So we have users that are able to access this information in their Apple EHR, if you will. But there's, I believe, 11 hospitals throughout the country that have agreed to this. Is that the number? Do you guys know?
I think it's 12, Tim.
Okay, so 12. Anyway, roughly, there's a couple. So how does a hospital use the app per se? How would that be different from you or myself using the app?
Well, so I think that's yet to be seen, because Apple, this is almost an announcement of we are intending to do this and they're rolling out slowly. But the idea is people have to be open to the tough part is companies like Cerner, where Bernie's working at Epic, they are restricting the free flow of this data. So Apple is kind of coming hey, let us be this in between where we can work out some sort of business model to be able to help the patient, because everybody's health record is your own property. Your health information is your own property. Everybody needs to know that. And they're trying to get better ways to flow that information. Like, for example, Taiwan, they actually have a medical ID card, which it's like a credit card that you swipe, you would scan it or swipe it at any hospital you go into, and all of your medical record is then available at that hospital. So it's super interoperable. But this, because of the way our structure is set up, Apple is almost trying to become this in-between where data can be extracted from the health record and in the patient's and become property of the patient, but then they can go to another hospital and potentially extract that information from the phone as well.
So if a hospital is quote unquote using Apple for their EHR, does that just mean they have a device that can extract the information from your phone and then make it presentable to the physician?
Mm-hmm. There's a lot of this idea. There's a lot of companies trying to do that, where this kind of becoming this interoperable in between. But Bernie, in a Cerner perspective, how do they feel about this type of technology?
Right. So I haven't had much conversation with people at Cerner since this is fairly new, but from what I can infer from this, so the data that gets inputted into here would then be available on the charts, or when you go into a physician's office and they're asking you all these historical data, whether your parents have any diseases or whether you're a smoker or any allergies that you have, it'll then translate onto your health record already. So I don't know if it's necessarily like a live upload, more or less maybe like when you bring the phone in, you probably it'll transmit somehow. But it kind of bridges that gap between asking for that historical data and taking time to do that when it's already being put into there. So then whenever you come into the office, the records are up to date. But one thing I wanted to say to that, Nathan, when you were talking about how in Taiwan, they bring their cards and they can just swipe their data. I think one reason why this has been so slow, and I know, Nathan, you know a lot about this, is your health record and your health data is so important nowadays. Your insurance information is almost like gold, right? Because people, if they stole your insurance information, they can essentially commit insurance fraud and get a bunch of money off of the insurance information that they have. So I think one of the things that these companies were really worried about is making sure that your data is safe in between this transmission.
So how much I love that you brought that topic up, and I actually looked up the stats today, wondering this exact question. The average health record. So before in 2015, the average medical record, United States medical record on the black market went for $50 a pop. So if somebody hacked into a system and stole them, they can make a massive profit. And what a stolen medical record is good for is they used to be able to use that record to then make claims, and with one medical record, a person can steal almost $20,000 in profit after purchasing it. But with that said, in 2015, it became such a high in-demand product, that the market actually got flooded with stolen medical records. So I don't know if this is good or bad. Actually, about half the United States medical records were stolen in 2015. So probably everybody that is listening, about 50% of you, your medical record is out there and stolen by, these hacker companies and are on the deep web somewhere. So feel good and comforted about that. But the price for a medical record plummeted to about $1 a record now. So they are not as lucrative on the black market. So I don't know if that's a good thing or a bad thing, but it's not.
The market is just saturated with records.
Well, so listeners, to put you at ease, if you have any doubts about the security of your health record moving forward, they're not able to transmit this Apple health record quite yet because they're so concerned with keeping it encrypted and keeping it secure on your behalf that they haven't quite fixed all the bugs, is my understanding. So for the time being, your information is restricted to your phone, and you would have to show it to your doctor because most of it is stored in an encrypted format in the cloud. This mysterious cloud that just follows us everywhere. So it's just sort of lurking around in there, but then you have to, in order to communicate your record to your physician, you have to physically show them your phone. So,
oh, wow. I didn't know that.
More to come on that.
Yeah. No, we'll definitely be, as that kind of goes on, we'll definitely be updating the audience on kind of what's going to go on. But hey guys, another thing I want to bring up, I don't know if we talked about it, and we'll try and wrap it up here, but have you guys heard about the backlash going out at Anthem right now? Like, it's hitting the news. Have you guys heard at all about it, Anthem?
Yeah, I saw an article about that today about ED reimbursement.
Yeah, so
right? Is that what you're talking about?
Yeah. Like, people are literally Vox accused. So Vox, Sarah Kliff wrote the article, former guest of the podcast. Sarah, big shout out to you. But they were actually accusing Anthem of potentially killing people anytime there's a change in kind of the way your medical plan works. That people are always accused of killing people. But what they did is there's a thing called avoidable ED visits, and I actually do research on that here in St. Louis. So avoidable ED visits, which predominantly are things like low back pain, upper respiratory infections, headaches, things that you do not need to go to the ED for. Anthem came out, this is back in the summer. Anthem came out and was like, hey, we're not going to, if you go to the emergency department for an avoidable ED visit, we're not going to reimburse that, so you're going to be stuck with that payment. So they're pretty much saying that the patients have to start taking awareness of where they choose to go get their health care. There were some couple caveats, like if you're younger than 15, you're excused from this rule. If it's a weekend, you're excused from the rule. If you don't have a quick care or a ambulatory care center within 15 miles of your house, you're left out of that. But people are freaking out because all of a sudden people are getting these unexpected bills. Like the Vox article, which I'll make sure to link below, they referenced a woman who she went for abdominal pain because she thought her appendix broke. Ended up being she had a cyst on her ovary, and according to Anthem, that was a avoidable ED visit. Now she has a $12,000 bill she has to pay for.
Yeah, I think that's a pretty hairy situation because if you feel something that may resemble appendicitis, and I think a large amount of the population, maybe not large, but a lot of people have a decent understanding of what appendicitis may feel like. So even though it's just low back pain, I think that, or lower right quadrant pain, I think that whether or not you present to the ED isn't contingent upon your diagnosis unless your arm's already cut off because you already know that your arm's cut off. Like if I have pain across my chest and that's a heart attack, I think that a person with massive chest pain should go to the ER, but maybe they were really drunk and fell and hit their chest on a curb or something the night before, and they're actually just fine and it's a bruise.
Well, Tim, you're bringing up the exact point why so many people are freaking out is because they're asking the patient, which I think is a good thing. They're asking the patient to, take more ownership of where they go seek care. But the main thing that people are arguing is the exact point that you're bringing up is, well, everybody thinks that, like, what if I do have chest pain? Well, they're not telling you if you have chest pain, don't go. But the big thing is, like, they're making people pause and think about, should I go to the ED or not? And a lot of people are jumping ahead and saying, well, since people have to stop and think, they're not going to seek care, and that's going to cause people to, oh, I have chest pain. I might have to pay. I might not have to pay. I don't want to go. But the other point, Tim, that you made up that you referenced in there is this is based off of your discharge diagnosis. You could literally go into the ED for you could have literally gotten shot, okay, or something. And you could have gotten shot and say like it was like a flesh wound and you were bleeding a little bit and like your arm hurt or whatever, and you go into the ED and just to get it like checked out the next day, but they end up charting your thing as like, oh, he had a wound on his arm, but he had like a wound on his arm that like was whatever. And if it's recorded as something that was not like life-threatening, like that was not in accordance to like kind of what you came into, all of a sudden you could have gone in for a very serious thing, but on the discharge paperwork and on what is billed to your insurance company, it is considered avoidable. Like lots of times people go in for chest pain and then it turns out to be nothing, so then it gets recorded in their record and then sent to their insurance company as like something ridiculous, and then they are going to have to pay for it.
So I'm in favor of giving people pause to run to the ED, because we talked about last week, Wash U's hospital, Barnes Jewish, has just absurdly crowded ED because of the people using it. But I think there is a decent motive behind Anthem's actions, trying to force people to think about going there prior to just using that as a primary care center almost. But I think there has to be more work done on, I guess, the analytic side of this, and we have to look more at the symptoms that patients are presenting with, as opposed to just using their discharge diagnosis to make these sorts of decisions.
I totally agree. I totally agree.
Yeah, and, guys, I'm going to play devil's advocate here, since I did have an ED visit within the past 6 months, and I did have I did have pause to think whether I should go to the ED or not. And so what basically happened to me was I thought I had a minor stroke. I had facial numbness and I had slurred speech while driving my car, and I pulled to the side of the road, and luckily my buddy was in the car with me. Well, I was fine a few hours later, and I was walking, I was talking fine, but it was like a moment of panic. And then the next day when I went into the office, I made a nurse's appointment, and my nurse practitioner told me I should head to the ED immediately. The physician that overheard everything that I said told me that I should go to the ED immediately. When I got into the ED, I told them my symptoms. They rushed me back immediately as a stroke patient. And my physician that was seeing me told me that I was an idiot, that I didn't go to the ED after I had my symptoms. But guess what was written off on my discharge papers after they cleared me? That I had a headache.
Yeah.
Oh my.
Yeah.
Yeah. So
guess how much my bill was.
How much was because what scan did they give you? Was it a?
They gave me a EKG, full lab work, a contrast MRI or whatever the highest. They had this new MRI thing that could see brain scans better.
Shit, dude.
They gave me the
full
works.
We talked about that in last week's health report. Go check it out.
Yeah. And to this day, I'm saying to this day, because I just got a bill yesterday, I'm still paying for that. Without insurance, that would have cost me over $12,000.
Yeah. God.
Yeah.
So you're still paying off your copay and deductible then?
Yeah, I just got a bill from the physician group that this ED physician was a part of, and that itself without my insurance was $900. And luckily my insurance paid some of it, and I only had to pay around $50. But my initial ED visit from the hospital was $8,000. And I had to pay $2,000 out of pocket.
Yeah, so worst case scenario, you would have had a stroke. Again, worst case scenario. You're a stroke patient.
Bernie, glad you're alive. Because that happened when you were driving, by the way. So.
Yeah, it happened while I was driving. I'm a 22-year-old, and this is not supposed to happen to me. So, the fact that I gave myself pause because, of course, I'm, an individual who looks into my own health.
I'm a strapping young lad. I'm a ripped young boy. I should not be having a stroke.
Right, that's just me having a stroke here. So of course, like I took initiative into my own health and was like, hey, like I probably don't need to go to the ED, right? But then when medical professionals advised me to go to the ED and told me that I was stupid because I didn't, now all of a sudden, if I had Anthem as my provider and they said, oh, your discharge said you had a headache, here's $12,000 that you have to pay off.
Either that or you take Anthem's side and reconsider going into the ED, and then you don't, and then you have a stroke.
Right.
Yeah.
So
it's kind of a lose-lose in your particular case based on the system that Anthem has in place.
Right, exactly. I don't think there's a lot of people out in the world that wouldn't have my case scenario, right? Like they would kind of look at it like, oh, would I rather suffer or would I rather pay a bunch of money for the rest of my life, right?
Yeah.
Something to think about.
Yeah. So, I mean, wow. That's a lot. It's a lot to chew on. It's a lot of topics. But, I mean, I think that's all we got for the audience today. We got some great stories. I don't know. Do you guys have anything else you want to talk about? Well, cool if we kind of sign out here.
Last week we had a what the health moment. Do we have any this week?
I don't know. Hold on.
Yeah, what the health moment this week is I'm glad I have insurance and I don't want to pay $12,000 out of pocket.
Okay, well, guys, I just want to say before we sign off here, thank you so much for joining us here on the Future of Healthcare podcast. If you guys want more information, please go to our website, wethefutureofhealthcare.com. Also follow us on Twitter, Instagram, and LinkedIn. Bernie just started a brand new LinkedIn page. So for all the young professionals out there, go like it. Links for all of that is in the description down below. Also sign up for a newsletter. The health report comes out every Tuesday. It is curated by your boy, Tim Mayo.
What?
And do you guys have any last words for the audience before we sign off officially?
Yeah, I just want to tell the listeners out there to eat your vegetables, stay away from Anthem, and go get yourself an iPhone.
Bernie.
Great words to live by.
Great words of advice from your boy, Tim Mayo. And with that said, as I like to end every podcast, go out, have a phenomenal day, learn something new, and together we can create a better future healthcare. My name is Nathan Dollinger, and I'm here joined today by our co-hosts Bernie Liu and Tim Mayo. And we'll be here next time at the Future of Healthcare podcast.